Hello everyone, my name is Barsa. I'm a second year student of AIMS Godakpur. So I think मुझे teaching करना चाहिए. So please support my videos. So today's topic is axilla. What is the meaning of axilla? In the Latin, meaning of axilla is armpit. Meaning of axilla is armpit. It is a pyramidal space and situation of axilla. It is situated upper part of arm and the chest wall. Upper part of arm and chest wall. It has an apex, base and four walls also. Apex, base and four walls. Four walls. Walls are anterior, posterior, medial and lateral walls. Four walls are anterior, posterior and medial and lateral wall. So now talk about one by one in sequence. So first of all, apex. Apex is directed upward and medially. Directed upward and medially. It is bounded by anteriorly by the outer surface of clavicle and it is bounded by medially by the anteriorly by the outer surface of clavicle and medially by the outer border of first rib. And posterior by the superior border of the scapula. Posteriorly by the superior border of the scapula. Scapula. These are the rough note. After end the video, I will provide my personal notes. So I can represent by a diagram. So representation of boundaries of apex. This is the first rib. This is the clavicle. And this is a This is the scapula. My drawing is not very well, so it is a schematic diagram. So this is the outer surface of clavicle, and this is the outer border of first rib, and this is the superior border of scapula. Superior border of scapula, and this is the apex of axilla. So apex of axilla is bounded by medially by the outer border of first rib, and posteriorly by the superior border of scapula, and anteriorly by the outer surface of clavicle. So now talk about the base. Base of axilla. Base of axilla also known as the floor of axilla. So base also known as the floor. So base या floor, it is directed downward, and now talk about the balls of axilla. So balls of axilla, there are 4 balls of axilla. Number 1, anterior ball of axilla. Anterior ball of axilla is formed by the pectoralis major muscle and clavipectoral fascia and pectoralis minor muscle. It is formed by the pectoralis major muscle, clavipectoral fascia also, clavipectoral fascia, and pectoralis minor muscle, and posterior ball of axilla. Posterior wall of axilla is formed by the subscapularis muscle above and teres major and latissimus dorsi below. So subscapularis above, teres major muscle and latissimus dorsi below. Latissimus dorsi below, and now talk about the medial and lateral balls. So medial ball is formed by the upper 4 ribs and upper part of serratus anterior muscle. Upper ribs and upper part of serratus anterior muscle. Serratus anterior muscle. Now talk about the lateral ball. Lateral wall is narrow because of anterior and posterior ball converge on it, so it is narrow, and it is formed by the shaft of humerus in the region of bicipital group and short-head of bicep brachii and coracobrachialis muscle. So shaft of the humerus and bicipital in the region of bicipital group. I can draw a schematic diagram so that represent all balls of the axilla. So these are the ribs, and this is humerus, pectoralis major muscle and pectoralis minor muscle, and this is a serratus anterior muscle, and this is subscapularis muscle and this is long head, short head of bicep brachii and coracobrachialis. So serratus anterior, anterior, and pectoralis major and minor muscle, and this is the subscapularis muscle, and this is humerus in the shaft of humerus in the region of bicipital group that is from the lateral wall, and then coracobrachialis and bicep brachii muscle. So what kind of so now talk about the content of axilla. So now talk about the content of axilla. We draw that diagram again. Serratus anterior muscle, subscapularis also, and short head of bicep brachii and coracobrachialis, and this is pectoralis major and minor. And now talk about the content of axilla. So there is axillary sheath and that contain axillary vessels, axillary artery and its branches, axillary veins and its tributaries. So axillary artery, axillary vein, cord of brachial plexus also, cord of brachial plexus and lymphatics, lymph node of axillary lymph node. So five groups of axillary lymph node, axillary lymph node. These are the content of axilla. We can write axillary artery and its branches, axillary vein, and its tributaries, axillary lymph node, five groups of axillary lymph node and cord of brachial plexus, cord of brachial plexus, lymphatic fat, axillary fat, and embedded structure on it. So these are all about the axillary content. So just revise all over the we can read now. So we read first of all what is axilla meaning. It is a armpit and what is situation. It is and it is a pyramidal space, and what is the situation of. So this is situated on upper part of arm and chest wall and and it has an apex, base and four walls. Four walls are anterior and posterior, middle and lateral walls also. And बे फिर हमने पढ़ा कि what is apex. Apex is directed upward and medially, and it is bounded by anteriorly by the outer border of first rib, posterior by the superior border of scapula, and anterior by the outer surface of clavicle. And फिर हमने देखा कि what is base also known as the floor of axilla, and it is directed downward. And then we can read about the walls of axilla, and walls of axilla are the anterior wall is formed by the pectoralis major muscle and clavipectoral fascia and pectoralis minor muscle. And then we read about the posterior wall is formed by the subscapularis above, teres major and latissimus dorsi muscle below. And then we read about the medial ball is formed by the upper ribs and upper part of serratus anterior muscle. And then we read about the lateral ball is narrow because of posterior and anterior ball converge on it, that cause the narrowing of lateral ball. So lateral ball is formed by the upper shaft of humerus in the region of bicipital groove and coracobrachial and short head of bicep brachii. एंड फिर हमने कंटेंट देखे व्हाट आर द कंटेंट ऑफ एक्जिला. सो एक्सिलरी सीथ, एक्सिलरी वेसल्स एंड एक्सिलरी वेसल्स मीन्स एक्सिलरी आर्टरी एंड वेन्स. Axillary artery and its branches, axillary vein and its tributaries, axillary lymph node, 5 groups of axillary lymph node, and axillary fat and embedded structure on it, and then brachial plex, brachial मतलब cord of brachial plexus. So this is all about the axilla. So thanks for watching. मिलते हैं नेक्स्ट वीडियो में. बाय.